growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner, and welcome back to the Lionhearted Dental Podcast. Today I have some really good stuff to share with you. And I want to tell you, that's not so easy a couple years into this thing. I sit down, I think, what would be the best thought to communicate with my colleagues this week that would impact them and make them do something? And I'm going to give you that in just a second. I want to first say just two housekeeping things. One is thank you again to everybody that tunes in. My podcasts last month were downloaded the record month of the best I've ever had. Mind you, it's just an inspirational thing for me. Whether I increase by 20% or 50%, no one pays me for that. It's not why I'm doing it. So thank you, especially to my European colleagues. You guys are all over my podcast. Ireland, Germany, UK. Thank you. And everybody. I think there's a couple countries where I have one follower, like Russia. Thanks. I'll take it. Again, I said this on a couple other podcasts recently. If you think you're interested, possibly, in jumping into surgery that we've so covered over and over again in these podcasts. Excuse the background noise, it's a vacuum cleaner. Sorry. I got to get these done. Look ahead at the Rasner Institute to 2022. They really fill up. I've never not had one sold out. And, the two that I'm about to do in the next 2 months are, of course, sold out for 2021. But 2022 dates are quite available. And if you're not sure, come in, pay an observer fee, and see if this is for you. You may not know if it's for you. So, what is it I want you to talk about? What I want to talk about. And this is very, very personal for me. Let me explain. When I look back on my 40 years, the things that made me the happiest in my memories, I mean this, is not my record-setting money week or case acceptance week or an amazing veneer case that came back in for a recall. The most important things that I can remember were the community service things. Don't turn me off yet, please. Were the community service things that I've been able to do because we put all the systems together that you hear me talk about each week, which I'm going to review for you in a second. I'm going to talk to you today about extraordinary success and how to get there. But the important point to remember when I'm telling you these things, and I don't really like to talk about some of my weeks and my record-setting numbers that happen, because I don't want you to think that that's what I'm about, nor do I want you to think that's what you should be about. Because think about it. If I give you numbers that blow your mind, and trust me, some of them blow my mind, and you work half the time. I'm 67 years old and thinking what my next 10 years are going to be like. I could work 2 days a week, 2.5 days a week. I work 4 right now. And still kill it. So you don't have to work and reach the numbers I have. It's like a powerful engine I'm giving you that you can drive at any place you want, any speed you want. And the cool thing is I've been on the other side into 40 years. I've been in the place where I was really worried about payroll. I mean it. And I've been on the side where, no case acceptance this month. And what the heck's wrong with my hygiene schedule? And those kind of things. And That's not a fun place to live. It dominates, it takes away your joy of what we do each day. But not only do you get rid of that anxiety when you follow Lionhearted principles, but it allows you to give back. I think of the unbelievable numerous things that we've done in community for my office. You would be heart touched, I think, if you knew how many things my office has able to give back and do. Quite honestly, we haven't in the last couple of years. Because of the pandemic, it's just not a good time to do these things. But over the course of my 40 years, we planned an event twice a year for the community. It could have been helping an African American church reestablish a mentoring program, a tutoring program, and raising money through a dinner that I threw, and numerous things that I've done through the Association of ARC, mentally challenged adults. Many, many, many things. I mean, I even had the fortuitous event in my life of getting a United States Congressional Award for having done so many of them, not even knowing that was a thing that could happen. The parents of these wonderful kids did that on their own after many times we've done things. But we did, single mother events that couldn't afford to do over-the-top things for the kids, and took them to see Walt Disney on Ice, and Christmas events and Thanksgiving events, and on and on and on. I couldn't have done those if we were a mediocre office with regards to success and just trying to get by. And I got to tell you something, I mean this. When I think back, again, they're the things that it almost makes me emotional right now to even think about them. And you want to talk about bonding and getting to do things that really are meaningful with your team. And you get outside your office and you planned this 3D event that's going to happen. And you planned it for months. And now it's that night and you're doing it. That is a way to form friendships and bonding with your team that often lasts forever. So let me tell you something I did today. We're in the beginning of September, and I went back and I looked at the weeks. I actually did a little research this week, and I looked at the weeks I've had because I knew I had a lot of good weeks, but I didn't go back and count them. Now I want you to keep something crisp in your mind. I have two offices. I do. One of my offices is I would consider a regular mom and pop office. That's my original office, by the way. And when I was in that office, the single office I had, we did well over $4 million a year for many, many, many years. And then when I moved and left that office into my present office that I'm in full time, that office, declined in its revenues because the associate there just doesn't do a lot of the services that I do, that I want you to do, that I want you to think about doing. So I'm not trying to confuse you, but when you hear the numbers, I'm going to share with you, and then here's the point. How's it possible? How do you get there? And we've talked about this for a couple of years, but I'm going to reiterate to you. Again, I want you to think about it carefully today. I want you to think about the fact that even if you don't get to those numbers, are you happier? Of course you're going to be happier without debt. There's a slide I use when I go and present live, and the slide says something along the lines of, hopefully you'll never go back into another Monday where you have the feeling that you need to get a case. It is just a wonderful, if that was the only thing you gained by listening to the Lionhearted podcast, the thing of not having pressure, being able to present clear-minded without anxiety. I hope I have a good week this week. I know what that feels like. Please believe me, I do. And not having that feeling and just presenting to people with good clinical education in your back pocket and speaking from the heart, being able to offer an alternative plan if you have to, because this particular patient has limited finances, which is a lot of folks that come to me. That's another podcast. Like, I don't go in with that mindset. Like, they're limited unless they make it abundantly clear. I always give a presentation case recommendation that I would do, and how I put it is if they can do it. I always say that. So I went back this year, and there's been approximately 32 weeks, obviously 4 weeks a month, from January through August. There could be an extra week because of the calendar. Maybe there was 33, I don't know. But in 29 of them, my office did over 6 digits collections. 6-digit collections. And very, very often, it was significantly over. I don't mean by like 105. I mean incredibly over. And 29 of those 33 weeks, we were over 6 digits. There are several stinker weeks sandwiched in those 32 weeks. Not many, about 4, that it just didn't come together. And it was, for me, it felt dreadful because, my measure of success is what I'm used to. And so what I want to really talk about is how is that possible? Some of you sitting there are doing whatever numbers you're doing, and you're thinking to yourself, how is it possible that he could really do those kind of numbers? And I'm going to tell you how it's possible. I've got a different podcast for every principle I'm going to tell you. Number 1, you have to have the right clinical skill set. You're never going to reach those numbers by prepping teeth all day. Now maybe you'll get into something that I didn't get into. Like, those numbers I just shared with you, they don't include any molar endo, because I don't do any molars. A lot of you do, I know. I think if I didn't do surgical dentistry, that personally would be an area that I would train really, really hard in, endodontics. And I would get myself a microscope, and I would go out to Buchanan and Cliff Ruddle and whoever are the superstars of endodontics. I did do that, by the way, in Crown and Bridge in the 90s, and I did a lot of training, personally, with Frank Spear and John Coys and other icons of dentistry at this point. I did it back, oh my God, like 20, 30 years ago. Now, it's shocking for me to say that to you. And, other people that you've heard me speak of, Pete Dawson and Jack Turbyfill, and my particular path changed and altered. Not only can you not do those numbers, it's just my personal opinion, looking back on my career, which is one of the reasons you're listening to me. You're listening to me, I hope, to save you time from the experience, at least of one clinician. And I think the other benefit of having a varied clinical skill set is that you're just going to get burned out doing Crown and Bridge. And you can also be disappointed at times, that something didn't work out and you're going to be compromised. Look, it's not just that I do surgical dentistry that accounts for that. I want to back up and tell you, it's having a complete, comprehensive mindset. That's the thing right there. When a patient sits in your chair for the first time, that is it. It's looking at this patient's whole mouth, even their muscles and joints, and asking yourself 5 questions that are documented in many podcasts I've already done, particularly in the beginning. But that I've told you, no matter what they come to you with, a broken tooth on the upper right, a desire for a checkup, I always look at 5 arenas, and I'm just going to name them. I always begin with the one I think is the most important, and that's the health of the periodontium. I don't care if they have 8 teeth left on the mandible. I'm looking at the soft tissue health, the bone, the osseous support, the amount of attached gingiva. Can we keep these teeth? All right? Number one, that's what I look at. And I don't think it's unique to me that the overwhelming majority of the population I've seen over 40 years is not healthy there. Number 2, I look at every single tooth. Do I change every restoration? It's not perfect? Absolutely not. I actually do a comprehensive approach with a conservative point of view. So if I see a forced surface amalgam, by the way, I'm going to make this 2 parts, this podcast, one on this subject, like how are those numbers achievable? How is it possible? And we're going through it right now. I can tell I'll never have the time to get through this meaningfully for you. If I see a large forced surface amalgam that was done 30 years ago, it may look a little stained. I can't find caries on the patient anywhere else. In that restoration. I often do not restore those unless the patient asks me to, if it's in the aesthetic zone. Really depends on all their needs. If you just converted every restoration that wasn't to your standard of care, I'm not sure how long you would be successful. And I want to tell you something. In the early 1990s, one of my mentors was a gentleman who I highly recommend to you, named Bill Strupp from Clearwater, Florida. He's very popular on Facebook. He's got a site called Strupp and Brunn, Brumn, I think. That's his Mike Brum, and that's his partner. They have like 12,000 followers. They do 2-day lectures a year on basic restorative. It's really a good deal, a good bargain. And they do one in Florida and one in San Diego. He did not ask me to say this. He doesn't need to. But Bill turned me on to gold inlays and onlays. And I was mesmerized by the longevity of success of those restorations. They're hard to do. I doubt that I ever did them as good as Bill does, or some of you. But I really went in strong to a lot of patients because Bill believes, and I do too, that indirect restorations made by a lab, and particularly gold when you can use it. He's changed a lot to these days. He's very into porcelain types of restorations. I forget what he uses. I can't think this, Lissy Press or something like that. Forgive me. I got a lot on my mind with this podcast. But he believes that a patient is better served by an indirect restoration than a direct chairside clinical restoration that you're doing. And I believe it too. And I believed it back then so hard that I went in. It was never about the money to me. It was about like, oh my God, look at these patients' restorations I'm doing. And you know what? I was right. 40 years later or 30 years later, because it was the 90s, they're my best looking patients. If you see me on Facebook, and by the way, I'd love to be your Facebook friend. It's look up Stephen L. Rasner, and you'll find me. And you'll see in my photos some of my older patients that I did 40 years ago. There's no doubt it's the best restoration you could put in the mouth to me. Absolutely. So, but the problem is I lost a lot of patients from my enthusiasm, from my overzealousness of how excited I was to do this. And over the years, I toned it back down. I became more insightful. What is the priority of this mouth in front of me? So I got off the track, but the first point I'm telling you is your skill set is the number one thing that affects your productivity, which affects your collections. And part of the skill set is going into an examination with a comprehensive care approach. And I was telling you, I look at the gingiva, I look at every restoration. And today, What I try to do is prioritize what I think would benefit that patient the most. And if a 4 or 5 surface amalgam on number 2 is holding its own, and the patient has a multitude of other needs, that won't be in phase 1. That's the truth. Number 3, I look at their missing teeth, and does that factor in to their needed treatment right now? Let me expound on that. If they're missing only number 30, think about it for a minute. And I know this is so obvious to me, but I have received a lot of new patients in the last couple of years because a younger dentist highly recommended a graft and an implant on a lower right first molar that's been missing for 30 years. Surely 31, tilted mesially, and 29 was a little distally inclined. And yeah, that would be ideal treatment, but the patient has got to want that in that case, because that's not going to lead to one missing tooth. Many of you can make your arguments against, counter to what I'm saying if you'd like. I get it. I think I try to be practical with you, and I'm trying to tell you that not every missing tooth that I come across do I feel compelled to replace. I have many patients who can't wear lower partials that replace molars, who have premolars and an upper whatever, and they're fine. Okay? But I have other patients that are coming to me because their other teeth are starting to have fractures and wear, and maybe they just got a new crown that keeps coming out on number 7, and they have an obvious collapsed vertical dimension of occlusion. That's a different ballgame. And I am very trained to treat that and diagnose that, as I know many of you are. See here, I don't have to replace every missing tooth, but sometimes that dominates that treatment plan. And I do look at their joints and muscles. And you want to know a revelation? A newsflash? There was a time in my career where I had spent significant time with Pete Dawson and his crew, Mark Piper, just brilliant dentist. And I even had a Doppler that was part of my routine daily, listening to muscles and joints and the opening and closing and clicks. And I did not get a lot of satisfaction from that part of dentistry, so I retreated over the years. And I refer, even though I look at muscles and joints, when patients come in and that's their chief complaint, I'm not their guy. And I don't feel funny a little bit about saying that to you. I find it a very unsatisfactory part of dental treatment, although albeit very necessary. There's too many more here that I'm going to go over in the next podcast. I'm going to read them to you. A relationship-based practice is very much a part of the numbers I gave you. A 5-star new patient experience and case presentation. I mean, how could you question that? Having a giant practice nucleus. I got to break all these down. Having great branding, and embracing getting paid up front. And I think all of you have heard me talk about all these things if you're not new to the podcast. But I don't know if you've really heard it in this light that I'm trying to give it to you in this one. Remember what I said at the beginning. Even if you never do 100 in a week, that's not even the point. The point is, do you have enough that you can do the things that make you happy? So, for example, can you travel the way you want to travel? You know, I always say in my podcast in the beginning, what do I think success is? And I think success is working when you want to work and not working when you don't want to work because you can. So not always fitting in. And trust me, I am guilty of having to work too much. Because I told you in an earlier podcast, I didn't listen to the advice I'm giving you because I didn't have anybody telling me enough. So I went with the big house, and I went with incredible cars, actually multiple houses. And I lived to pay bills early in my career. I did. And I highly, highly think that's not the road to travel. So stay tuned next week. This is good stuff, I think. And I hope you're listening. I hope I'm helping you. Please write to me. Following the Lionhearted principles is such a locked down blueprint for achieving consistent success. I don't know if it gets out to enough people. I don't know why anybody wouldn't buy into it. It's about being ethical, and it's about delivering a product. When I say product, I don't just mean your dentistry. I mean your whole organization that you can feel good about. See you next week on The Lionhearted.